Hello, nursing students. Today's PowerPoint lecture is on immunizations, otherwise known as vaccines. Vaccines prevent specific infectious diseases within communities. They do this by either stimulating the immune system to produce antibodies or by supplementing the immune system from antibodies from an outside source. The CDC is the one who bases what recommendations we need for immunizations by patient population group. When we give a vaccine, the immune system will then produce antibodies that target a specific microbe, usually contained in that vaccine. The vaccines will either have killed viruses, live viruses, or weakened viruses, which are called attenuated viruses. Vaccinations help to prevent disease. There are several different ways that immunity to diseases can be conferred, and we'll talk about them now. First, immunity can be acquired passively or actively. Active immunity happens when clients produce their own antibodies in response to an antigen. This type of immunity can last a long time, but takes varying amount of time to develop. Passive immunity happens when clients get antibodies from an external source. That lasts as long as the antibodies are alive, but it is effective immediately. Immunity can also be conferred in a natural or artificial way. When a patient's body produces their own antibodies, or they are transferred from the mom to the fetus via placenta, or an infant via breast milk, that is natural immunity. Artificial immunity is conferred by being given either a vaccine or a toxoid or direct injection with an antitoxin or immunoglobulin. Artificial active immunity develops when clients take a vaccine, exposing them to an inactive form of the disease, which stimulates the production, again, of antibodies. So an example of a natural active immunity would be when someone is exposed to a disease like chickenpox and then they develop an active infection. They're going to get those antibodies. Natural passive immunity would be when a mom has chickenpox and it's conferred to the infant who's being breastfed through her breast milk. Artificial passive immunity is when an individual is exposed to a disease like hepatitis without having had a vaccination against it. They get injections of immunoglobulins to help prevent the infection of hepatitis. These immunoglobulins confer immunity as long as they are alive, and they may require multiple injections to continue conferring immunity. Usually there are 3 in a series for a hepatitis vaccination. When artificial active immunity is conferred using a vaccine, that vaccine contains a form of the disease that has either been killed, is alive but has been attenuated, which we said was weakened, or is a toxoid, which is a toxin that has been changed into a non-toxic form. What is the purpose of immunizations and vaccines? What do we expect them to do pharmacologically? Vaccines cause the immune system to produce antibodies that provide active artificial immunity. Immunizations can take months to have an effect, but confer long-lasting protection against infectious diseases. Immunizations have been useful to eradicate infectious diseases like polio and smallpox. They also help to prevent childhood and adult infectious diseases like measles, diphtheria, mumps, rubella, tetanus, and influenza, and any complications associated with those. However, immunizations do have complications, contraindications, and precautions. If a patient has an anaphylactic reaction to a vaccine, such as they can't breathe or they have a decrease in blood pressure and need life-saving support, that's a contraindication for any further doses of that vaccine. If someone has had any kind of reaction to any component of the vaccine, that's also a contraindication for use in subsequent vaccines containing that substance. A common substance is an allergy to eggs, which can be part of a vaccination. If someone is severely immunocompromised, we definitely don't want to give them any vaccinations or immunizations that have a live virus attached to them, like the chickenpox vaccine or the measles, mumps, and rubella vaccine. It could cause a severe febrile illness and is a precaution for all immunizations. Providers have to analyze data and weigh the risks that come with immunizing versus not immunizing and which precautions should be taken. If someone gets moderate or severely ill with or without a fever, that is also a precaution to receiving an immunization. However, a minor cold or other minor illnesses are not a contraindication or precaution for receiving immunizations. The Center for Disease Control gives the recommended childhood immunization schedule. You can always check their website for updates. I have updated this as of the recording of this lecture. As you'll notice on the left-hand side, children ages 0 to 6 years old have quite a few vaccinations that they are required to get. Also, if you notice, many of them have multiple doses. The Tdap, DTaP, the pneumococcal, all those have multiple doses that they need to do. Same with polio. And they also can allow children to have the COVID-19 immunization as young as 6 months, as well as the flu for 6 months. Now, if you notice at the top, though, to get the RSV antibody, it depends on if the mother is positive for it because she may have transferred that to the child. And then as they get a little bit older, it depends on if they're getting frequent RSV infections. That would make you want to have the immunization to prevent any further, or to prevent further and as strong of an illness as you were previously getting. From the ages of 7 to 18 years old, there aren't quite as many vaccinations, but notice the human papillovirus, HPV. That is something that we want to give to children when they start to enter the prepubescent years. We've also got a booster for the Tdap when they're hitting those prepubescent years. And then notice the flu virus is now recommended every year beginning as young as 9 years old, as well as the COVID dose if you hadn't gotten it prior to 7 years old. I don't expect you to memorize all of the indications for these particular vaccines, but I do expect you to know their names. So you need to understand that HPV stands for human papillovirus. I may put on the test one of these abbreviations, and you have to tell me what the immunization is. This slide gives you the names for all the abbreviations from the previous slides, so you don't have to look them all up. Isn't that nice? If you notice, they want you to get your COVID vaccine if you haven't done so by the time you're an adult. They would like you to get a flu vaccine every year as an adult. If you are pregnant and it's the winter time, they want you to get a respiratory syncytial virus immunization. Also, if you're pregnant, they want you to get an update of your tetanus, diphtheria, and pertussis, your Tdap. Also, your measles, mumps, and rubella can be repeated as a booster every 10 years. So just remember that as adults, we're usually doing boosters or getting vaccines that we may not have had when we were little. Finally, let's talk about nursing administration for immunizations or vaccines. That means how are we going to give them to our patients? For infants and children, we need a consent sign from the legal guardian or parent prior to giving them anything, of course. The injections will go in the vastus lateralis, the shoulder or the ventrogluteal muscle or the side of your thigh in infants and young children. And then as children get older, we can put them into the deltoid muscle. That was for intramuscular injections. If it's a subcutaneous vaccination, we can give that in the outer aspect of the upper arm or the anterolateral thigh. When giving vaccines, we always have to use the appropriate needle size for the route, for the site, for the age of the patient, and the amount of medication. We also need to make sure that the needle length is correct so that we put that medication right into the layer of skin that it's supposed to go. If you look on our slide here, you can see some of them go into the muscle. You will need a much longer needle for that. Some go into the subcutaneous tissue. Some of them might be right there on the surface in the epidermis. So be sure to check that out. Sometimes you can apply a topical anesthetic to children. You can give infants a little bit of oral sucrose, which is sugar, 2 minutes prior and 3 minutes afterwards to help soothe them from the trauma of the needle. But we always want to minimize the discomfort. We can also provide distraction as well. We want to try and not let the child delay the procedure. That just makes it more difficult. Legal guardians or parents are wonderful at providing comforting measures for the children when we have to give them vaccines, and we should definitely involve them in the procedure and the care. We always praise children after they have completed a vaccine. We can also apply a colorful Band-Aid, if appropriate, to help make it a more pleasurable experience. We also want to remember that for children, we want to avoid the administration of aspirin to treat fever or a local reaction after they've been giving a live virus vaccine because they can develop a syndrome called Ray's syndrome, which can be life-threatening. We'll talk about that a little bit more later, but just know that we don't want to give Tylenol after children's vaccines because they can develop Ray's syndrome, which can be life-threatening. I said Tylenol, but I meant aspirin. Don't give aspirin for a fever or a local reaction pain after vaccination. For adults, we can give intramuscular immunizations right in the deltoid muscle. For subcutaneous, we can use the outer aspect of the upper arm or, like children, the anterolateral thigh. Because anaphylaxis is a possibility whenever we are giving vaccines, we need to have emergency medications and equipment on standby in case they actually do have a reaction and we need to start getting those responses immediately. We always want to explain to the patient or the patient's guardian what the vaccines are. We want to make sure they understand the positives and the negatives of receiving a vaccine. We always instruct parental guardians or the patients to look for complications and notify the provider if anything weird or adverse happens. When documenting the administration of a vaccine, you have to include the date, the route, the site of the immunization, the type of immunization, the manufacturer, the lot number, and the expiration date of the vaccine. We also have to provide evidence of that informed consent that we obtained before giving either an infant or a child or an adult a vaccination. As the administering nurse, you need to also be on the information that is documented, as well as if it's a child, their legal guardian's name, address. Serious or unusual adverse effects should be reported to the Vaccine Adverse Event Reporting System. They have an 800 number you can call and a reporting form that can be printed from the FDA website or the CDC website. When a patient develops an immunity to that disease, the medication has been effective. We also want to look for effects of pain, fever, and swelling at the site of injection.